Today we will see about the introduction to community health nursing. Okay, community health nursing is a very vast topic, but most of the students did not attend my class. So rather than repeating that, I am going to make this small video just to know about the introduction of community health nursing. By this video, you will understand about what is the subject, what are all the things we are going to study in a community health nursing. First, we will see about what is community. What is community? Community means a group of people living together, and these people will have some of the common ideas and opinions, and they have the sharing, they have the values, they have the beliefs, and some area they will be standing, and they all this morality they will be having. So this is the community health nursing. What is the concept of community health nursing? They have the moral, they have idea, they will be sharing their ideas, and they will be exchanging this one, and sharing recreation, many things they will be doing in this main concept. So in particular area, some of the people will be living, this one is called the community in particular geographical area. So in this chapter we are going to study about what are all the subject we are going to, what are all the topic we are in detail we are going to study. First of all, you have to understand about why the community health nursing we are studying. So the community is a vast area, isn't it? If you take an individual, there are different kind of systems are there in our body, is right? So what are all the systems we have? We have like a respiratory system, we have cardiovascular system, we have immune system, integumentary system, various system. One system is completely integrated with another system. So same way, community also have various subsystems. So what are all the basic subsystems we have in community? So in this chapter we can know what are all the subsystems. Maybe anything, maybe the religion is the subsystem, the healthcare is a subsystem, and the politics is a subsystem, communication is the subsystem, recreation will be the another subsystem, isn't it? And the economic is the subsystem. So economic, politics, healthcare, isn't it? Communication, religion, caste, culture, all these are called the subsystems in the community. So the environment is another major subsystem in our community. So what is this environment? Environment means what are all the things is there in this subsystem. So in this community we are going to study in detail about, maybe the first year maybe we'll be study about what is environment, what is the environmental health, why the environment is related with the health, what are all the environment, like what are all the basic concepts of the environment, what are all the types of environment, and we will study about what is health, one unit, what is the determinants of the health, what is the how the health is related, what who is called the good human, healthy human being, we will be seeing. And communication is very very important. We are studying in the fundamental of nursing also in a community. So in communication means everything, communication and health education, everything we are going to study. Economic, this will be, you will be studying in the fourth year. So if you see, these subsystems or one system is related with another system. For example, environment is a very big system. For example, any problem is coming in this environment. For example, some storm, something is coming, so natural calamity is coming, so the total environment in the community is going to get affected. So once the environment is get affected, the healthcare is also going to get affected. Then the political system also have detached, and the communication system is also been affected. For example, in a community, maybe the culture, I told you the culture is the another subsystem. Sometimes some of the cultural and caste, some belief, some fight or something is going into this community, again the community system is going to affect that. So the community health nurse, it's your responsibility, we have to study about all the things. What is the healthcare system in a community, what is called environment, if the environment is polluted, what all the diseases will be coming, what is our political system, how the political people are making, how they are making the policies, and what all the policies being implemented along with the central government and state government and along with the WHO. Yes, we have seen about community is different kind of the subsystem in our this one. Okay, as a community health nurse, you have to assess the system, isn't it? It is called assessment, isn't it? Assessment. Once you assess, what you will be doing? Once you are assessing, what you will be doing? You will come to able to diagnose, isn't it? So, diagnosis. So, once you diagnose, you will identify what are all the community problem, what are all the things you will understand. So, assessment, diagnosis, then planning. Planning and implementation. Implementation, you will see what are all the then will be the evaluation. Okay, this is the evaluation of the subsystems. Okay, now we will see what is called this assessment. So how are you assessing? So assessment, how you will be assessing this one? If you are assessing the individual health, so you will be assessing, there is a criteria for assessing the individual health. You will be checking your vital signs of the individual, isn't it? So vital signs will be checked, temperature, pulse and respiration will be checked for this individual one. So how I am going to measure the community health? This is the individual measurement. I will measure the individual health. This is the community health. How am I going to measure the community health? How am I going to assess the community health? So the community health assessment can be done by rate, ratios and proportions. Rate, ratio and proportion. So who is going to do this rate, ratio and proportion? Here who is going to do? So the individual health assessed by the doctors or nurses. Here the community health is assessed by the epidemiologist. Okay, this is the one epidemiologist will be assessing. So how are they going to assess the epidemiologist? This epidemiologist will be assessing this, if this is the community, and they will take a proportion of the population and they will be studying of this population, and this population will be reflect the total health of this whole community or the country. So it is a very important aspect of studying epidemiology in community health nursing. There is a one unit you will be studying what is called epidemiology of community health. Epidemiology. So epidemiology. So demo means people. Okay. Logy means study. Epi means upon. So logy means study. So it is called study upon the people is called the epidemiology. So epidemiology is a study of distribution, determinants of health related event in a particular population and study. This is the particular population has been taken, and application of this study to control the disease in the country or the community is called the epidemiology. So the epidemiologist will measure and they will tell about vital statistics. Vital statistics. So the vital statistics is the vital information about the community. How I am going to, this vital statistics is going to help me to assess the community health. So vital signs, how this is important to assess the individual health. Same way vital statistics is going to help me to assess the community health. What is rate? Rate. Morbidity rate, mortality rate, healthcare rate, healthcare utilization rate. All these rates are having numerator and the denominator into 1000. For example, if you take the population in your area, for example, this Bankura district, what is this? So what is the death rate of Bankura? People died by the corona. If they ask, the total population will be coming in the denominator. Total population of the Bankura, how many lakhs of population will be coming here and how many people died by the corona into 1000 population. So I will understand. By understand not only this corona, this is an example. I can imagine, the government will be taking. So this unit, when you are studying, you will study about what is called vital statistics. It is a systematic collection and compiling of these data about the healthcare data, and these data will be helpful to measure. This is called the measurement of community health. Rate ratio. For example, if I want to measure one table, what I will need? I need some of the tools for the measurement. What are all the tools? Maybe tape I need, or the pencil I need, whatever it may be, I need it. So I will measure. This is the height, this is the width of the table. Same way, what is the community? What is this community health? These are all called the tools of measurements of community health. So once I measure this community health, I can able to diagnose the community health. So what is this diagnosis? What is this importance of this diagnosis? So the diagnosis will be helpful for me to plan for the community program. So I will diagnose for this particular area, Bankura district, most of the people are having this particular problem, will be assessed and will be collected by the vital information by the municipality, by the government, or the people who are admitting, coming to the Bankura hospital, medical college hospital. How many are coming? According to that statistics, they could be able to diagnose the Bankura's health, Bankura district health, and accordingly they will be planning. So the planning formula. What is planning formula? Always you have to remember the planning formula. Where, when, how, whom, and why. These questions will be really helping you to the community health planner to plan the program. So they will plan accordingly the implementation program in the Bankura district. Then this implementation will be differ. If an individual implementation, maybe if they are diagnosed as a temperature or COVID-19, whatever it may be, that one will be individually, will be giving a tepid sponging, giving the cold sponging, whatever the medicine for the individual. But it is a community. In the community, you have to see it is always implementation in a 4 aspects of implementation. What is that? Primordial, primary, secondary, and tertiary implementation. So this is always called this is a primordial. What is the primordial? So anything you are studying, you have to remember this is a 4 level of the implementation. Implementation, you have to do it. Primordial always health awareness, health motivation. You can give many kind of awareness. You can give health education to the individual, mass and group. You can give it to the people, and will be the vaccination, immunization also can be given. Then that is called primordial, as well as the same thing what you are writing in a primordial can be able to write in a primary also. Then in the primary, in additionally you can write something called screening. You can screen the people. You can collect the history, screen, door-to-door screening, or whomever is coming. You know COVID-19, how they have done a screening. Even door-to-door they came, they have screened the people. So screening. So yearly identify, you will do this, isn't it? So once you screen, you will identify yearly cases, yearly identification. So you can come for the yearly isolation too. Then after yearly identification, yearly screening, yearly isolation, you can go for the secondary level of a prevention. Or this one, you can yearly admission to the hospital, yearly taking care, yearly implementation of the healthcare. You give the admission, give the what are all the necessary things for this COVID, you need them, or any other diseases given there. Then tertiary will be continuation of the secondary, will be the tertiary. So the specific protection and rehabilitation, you can do it. What is called rehabilitation? And then one question may come, madam, rehabilitation only tertiary we can do? No, rehabilitation, first of all, what is rehabilitation? Rehabilitation is a social, medical, vocational measure to train and retrain the individual to live the optimum potential life with with minimal guidance or without any support they could be able to live or lead their life is called the rehabilitation. Rehabilitation can be, even though it started from the beginning. Once the patient is diagnosed with hypertension, the rehabilitation should be begin. Not you have to wait until they develop a stroke and give the rehabilitation. That is why in a community we have to more focus upon like a primordial and primary. So the healthcare cost is going to reduce for our country. So this is one. So again, like primary prevention, you will be giving a health awareness, health motivation, like a varial level, and healthcare vaccination or immunization can be also added in a primordial prevention, and will be early screening, early notification, early identification. After second primary, secondary, yeah, once you have notified early this one, you can give them early treatment, started giving them admission in a community care hospitals and giving them the treatment and reduce the disability and prevent them to going to the tertiary level and prevent the disability. And here will be the specific protection, and also we will do for the rehabilitation, specific health care, not a protection, you can tell specific detailed healthcare you can give it, and the rehabilitation you can start to prevent the disability. So what we are doing in the community, we have seen what is community health nursing and what is the definition of definition. We will see what is the definition of community health nursing. Community health nursing, community, we have seen what is the definition of community. And what is health? Health is a complete state of physical, mental, social well-being, not merely the absence of disease or infirmity. And what is community health nursing? Community health nursing is the discipline where we are taking the knowledge from the public health and the knowledge from the scientific knowledge from the nursing and application of this knowledge to mainly promote the prevention and the promote and prevent the disabilities and promote the health in the country or the community is called community health nursing. See students, always you have to remember two definition. You have to remember this ANA definition as well as you have to remember the Virginia Henderson definition. You have to study. What is Virginia Henderson mainly will be telling? Community health is not only for the people who are sick, also the people who are not sick, ill as well as the sick. This is what the concept of Virginia Henderson. So it is very important for you to remember the two definition. Then what else we have seen? We have seen about what are all the 10 subsystems in the community. What are all the systems in the community. Then I talk to you about what is the individual, what is the systems. Like every individual will have so many systems, respiratory system and like indumentary system, cardiovascular system, everything is there. Same way community also will be having a different form of a 10 subsystems we have seen. So how the individual, one subsystem is related with another subsystem, community also one system is affected, related with interrelated with another system. One system is getting affected, other system will be having an impact. If an economic system is affected, the healthcare is also going to affect it. Example, Sri Lanka, now economic is going down. They do not have the money to buy their own medical expenditure. So, economic system, if a healthcare system is affected, directly our healthcare of the community is going to affect it. If the political system is affected, again coming back to Sri Lanka, what's happening? The politician is not good. Politician cannot implement any of the care or anything to the Sri Lankan people. So the other nations will be helping them. And that is environmental is a big system. Sudden tsunami is coming. Sudden natural calamity is coming. All the communication and other system is going to completely cut. This one area, one geographical area will be isolated due to the tsunami. So the communication, everything is cut. Again the healthcare is going to affect it. That is what we have seen in the introduction of the community. Understand? Okay, so So we have seen about the subsystem. So this subsystem, we have told that these subsystems are interrelated with each other. The community health nurse is going to do the assessment. So how are you going to assess? The assessment of the individual health as well as the community health, I taught you, right? So the individual we are assessing by the vital signs, community we are assessing by the vital statistics. I told you what is vital statistics. It is a systematic collection and compiling of the vital information. What is vital information? Death rate, ratio, death, morbidity, mortality, all these things. What is morbidity? Its morbidity is called the disease condition. Mortality is the death rates, all called this one. I told you with the examples. So different, if you take a Bankura state, you are assessing, you will diagnose what is rate, what rate is high, corona rate is high or death rate is high, maternal mortality is high, or infant are dying or patients are dying with tuberculosis. Accordingly, you can diagnose the Bankura district's community health. So community, this is called community health diagnosis. So this diagnosis helping us to plan for the community program. So community program, where I am going to do, when I am going to do, how I am going to do, to whom you are going to do, isn't it? Then we are implementing. Always community health or strategically we are implementing into primordial, primary, secondary and tertiary level of implementation. Afterwards, we are going to assess how this system is improved or not. What is called? This is called evaluation. What is this evaluation? How will I evaluate? So evaluation and the feedback. Okay, how will I evaluate? Again I evaluate. How I will evaluate? The evaluation mainly by rate, ratio and proportion. If the what is the rate above what is there and what is the rate below, is it reduced or not? After implementing this program for the Bankura people, the death rate is reduced or not, then this is called is the feedback. Once the feedback is positive or negative, I can replan the community health programs. So this is the difference. In next class and forthcoming class, we can see detail about each of the systems. Thank you.